Hi, my name is Dr. Mitchell Greenberg, and I'm a co-founder of Mindful Mental Health Services. This video has been developed to provide you with additional information relative to our services and the potential opportunity for what we term network partners who are interested in exclusive territories conducting our business in their areas. To give you a little bit of background, Mindful Mental Health Services has been in operation since 2012. We rebranded the predecessor company in telehealth as Mindful Mental Health Services in 2020 to take this initiative national. My background as a physician allows me to be able to manage large group practices, whereas my co-founder, Danae Caper, who is a licensed clinical social worker, psychotherapist, is our clinical expert. There is a great unmet need for mental health in society today, particularly in the demographic in which we target, which are primarily seniors who reside in assisted living, nursing home, and long-term care facilities, although we do treat individuals in other settings as well. The type of therapy that we do is cognitive behavioral therapy, talk therapy, psychology. So we do not do psychiatric medication management, but we do work collaboratively with those who do. The way we deliver care is through a sales and marketing business approach where the territory owners will approach assisted living, nursing home, wellness directors and director of nursing to provide information relative to our services. The referrals are made by the wellness directors or director of nursing from these communities or facilities for various clinical conditions. To name a few, but these are not limited to, transition, adjustment, depression, anxiety, grief, addictions, behavioral challenges, individuals that have chronic pain, individuals that have chronic disease. And the way we facilitate therapy is that we assign our providers to particular communities within a reasonable driving radius of their homes. So the model is that we obtain the referrals for the providers through our sales and marketing efforts. We provide them with the referrals after we have verified insurance and obtained consent if that is relevant in that particular situation. And then the provider goes in and does the therapy in these communities in the privacy of the individual's apartment or bedside. It is an efficient model because the therapists can see their patients back to back in 1 or 2 or 3 buildings that they are assigned to. They then chart on an electronic health record that we provide, which is called SignOut. SignOut is a private label software by our billing partner who offers this in conjunction with the billing. Therapists chart on SignOut. It's a web-based program that's Medicare compliant, state-of-the-art mental health record. And then they hit the billing button after they chart, and then the billing company knows to submit those claims for billing. Providers are paid on a percentage basis. Typically, we pay LCSWs 60% and psychologists 65%. And one may wonder why the difference, considering they're doing the same exact visit types with the exact same treatment approach in most situations, or cognitive behavioral therapy. Primarily, there is a degree bias. Psychologists typically are reimbursed 20% higher for the same visit types that licensed clinical social workers are. So we pay them a percentage of all monies received secondary to their efforts. This model has been developed to mitigate financial risk. So providers are not paid unless they do the work. They are independent contractors. There are no benefits paid to our providers. They are responsible for their own liability insurance and their own expenses. Often providers are piecemealing their work through multiple employment sources, including private practice, working for other like companies. And our model allows for flexibility for providers. It's a very attractive model for many providers, whereas some providers would not be interested in this because they're interested in traditional bricks and mortar practice and seeing patients in that fashion. Our model is that we go to the patient either face-to-face or via telehealth mental health therapy. What COVID has resulted in, if there's anything positive about COVID, it's said to be telehealth therapy. Telehealth in the past was not able to be done because reimbursement was less. It required it to be conducted over sophisticated technology and was restricted to just rural areas. Recently, because of COVID, they have relaxed all of those. So reimbursement is now the same as face-to-face. It can be delivered over simple cell phones. And anybody, urban, rural, can obtain mental health therapy. The business is a three-legged stool business. Network partners who decide to entertain a management service agreement with Mindful Mental Health Services will be doing fundamentally three types of work on a daily basis. Back office administration is one leg of the stool. Well, they will be processing referrals, doing payroll, obtaining consent where appropriate. The two larger legs of the stool are sales and marketing and then provider recruitment. Provider recruitment is continuous. We continue to recruit providers to facilitate growth. Provider recruitment is obtained through various ways: traditional advertisements, email blasts, exhibiting at statewide psychology and licensed clinical social work educational functions, and many, many more strategies. Sales and marketing. When a network provider comes on board, we develop a territory for them. And within that territory, we identify all the potential assisted living, nursing homes, long-term care facilities, and we provide a database for the network partners. This database can serve as a sales and marketing tracking document. So the way that sales and marketing and referral generation is facilitated is through cold calls, face-to-face meetings, and then many other value-add functions that Mindful Mental Health Services does for assisted living communities. Assisted living communities rejoice at this because it does not cost them anything. There is no cost to the patient. Referrals are made by the wellness directors. Physician orders are not required. There is no downside for these wellness directors and directors of nursing to adopt our services into their environments. In fact, it differentiates them in the marketplace. So sales and marketing is continuous in identifying potential referring sources. What we provide our network is just the tip of the iceberg relative to the global opportunity within their territory. They are able to find additional sources through corporate relationships with home health companies, companion care companies. They're able to market their services to primary care providers, special interest organizations such as Parkinson's, Alzheimer's, other types of organizations where outreach is important and therapy even more important. So it's just the tip of the iceberg. Our revenue model, often network partners would like to know what it is that they can make. We have developed an economic model that lays out the potential revenue that each territory could produce through their efforts. It's segregated by 1 patient, 100 patients, 200, all the way to 1,000 patients. And this model, which you will review if you're interested, will be in a PowerPoint presentation. If an individual is interested in a Mindful Mental Health Services exclusive territory, we have a process to facilitate that. It begins with a discussion between our business development team, and from there, we are available to answer any questions. If an individual would like to move forward with us, then what we do is we send out a letter of intent. The letter of intent discusses a due diligence period of 14 days. During that due diligence period, what we do is we develop a territory that has adequate numbers of potential patients, and we also examine healthcare laws and legislation to be sure that our model is healthcare compliant in the particular state. If you would like additional information relative to acquiring a territory, please feel free to contact us via our website, mindfulmentalhealthservices.com. Thank you.